A national emergency declared today by the president.
President Trump staged a pageant in the Rose Garden in an apparently successful attempt to pump up the stock market, while he also lied about where things stand. Nancy Pelosi, House Speaker, hammered out a deal with Treasury Secretary Steve Mnuchin on a coronavirus aid package that includes, among other things, free testing and paid emergency leave.
Speaker Nancy Pelosi announcing tonight that she has reached an agreement with the administration after days of negotiation. The package includes free coronavirus testing and 2 weeks of paid sick, family, and medical leave. It would also strengthen unemployment insurance and boost food security initiatives. This comes only a few hours after Trump slammed the Democrats for not doing enough without specifying exactly what he thought the bill was missing.
Dr. Fauci said earlier this week that the lag in testing was, in fact, a failing. Do you take responsibility for that?
Yeah, no, I don't take responsibility at all because we were given a set of circumstances and we were given rules, regulations, and specifications from a different time.
You said that you don't take responsibility, but you did disband the White House pandemic office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it.
Beth Cameron actually served as a senior director for this office, the Global Health, Security, and Biodefense Office in the White House National Security Council, wrote an op-ed about the council being shut down. It was titled, "I Ran the White House Pandemic Office, Trump Closed It. It's impossible to assess the full impact of the 2018 decision to disband the White House office responsible for this work," she wrote. "Biological experts do remain in the White House and in our government, but it's clear that eliminating the office has contributed to the federal government's sluggish domestic response. What's especially concerning about the absence of this office today is that it was originally set up because of a previous epidemic, made the need of it quite clear. Pandemic threats may not arise every year, but the White House should constantly prepare for them. We can't afford for federal decision makers to waste time relearning old lessons, that they should be innovating and acting."
Trump's own former FDA head, this is a Trump administration official, was calling for the actions like the ones being taken today to be taken 6 weeks ago, and not in some private back channel on Twitter where anyone could read it.
Now, what we know about the president and how President Trump has handled this crisis is that he has tried to ignore the advice of scientists and his own advisors, notwithstanding not having this team in place. And 6 weeks ago, when the first case was identified in late January in the U.S., he wanted to deny that this would be a problem. He reassured the public, saying this is nothing to worry about. It's only one person. He did not do what was necessary to deploy testing across the United States. And what we know about pandemic preparedness is that timing is critical because outbreaks grow exponentially.
In the U.S., there are now over 2,100 cases and 49 deaths. Remember, we only passed the 1,000-case mark 3 days ago. Based on everything we know, Italy is probably the closest estimate to the trajectory we're on, with a lot of unknowns. Today was Italy's worst day so far. Italy had 2,500 new cases just today, 250 new deaths today. More than 1,200 people there have now died. These crazy new mortality numbers are unnerving because it looks like if we continue at our current rate, the U.S. may very well soon be in the same place.
How much testing is going to be required? What is the timetable on that testing to get these answers to how fatal this is, what the infection rate is, those basic questions that everybody's asking?
Well, that's a very good question. And in fact, we're well behind the curve on our testing. Let me explain. South Korea should be our model. And South Korea has done 120,000 tests, and they have a population of 51 million people. We have a population of 350 million people. And as you just said, we have about 16,000 tests total that we've done since the beginning of this threat. And what you do testing for is to understand how you do social distancing most efficiently and with the least disruption to people. So we're way behind the curve.
We need every level of government to make the right decisions to prevent human suffering, to prevent the spread of this virus.
What Nancy Pelosi announced today, and my hat off to her, congratulations, is an important down payment. It is not the big sweeping economic response, but what's critical about it is that it's doing the quick emergency things that is kind of, I guess, Stephen, I'd say a win-win. They are wins in that they are helping people and families who are getting hit the hardest, but they're also things that will help contain the community spread. Because if you know you have sick paid leave, if you know you have nutrition, if you know you can get free testing, those things are going to make people more willing to see how they're doing, more willing to tell their employer if they're sick, more willing to stay home and self-isolate if they have symptoms.
But now FEMA has the ability, as governors begin looking at what additional assistance may be needed, particularly in the coming weeks. FEMA's prepared to coordinate that with both the funding and the coordination of the direct federal assistance. And if we can all do our part, wash our hands, keep our distance, where we can stay home, stay home. If we're having to go into work, we need to do due diligence. And if you're not feeling well, stay home. To give time for testing, but also to keep the system from being overwhelmed, to allow those patients that do become sick to get the maximum treatment available.
I can tell you that at the local level, those of us who are mayors that are in our communities are seeing such tremendous anxiety and fear. But this is a time that we must be driven by facts, not fear, and take the precautions that are within our power right now to prevent the spread of this virus.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.